Hi everyone, how are you? I hope all are fine. I am going to teach you the subject research. In research, there are 8 units for BSc nursing students. Okay. Now I am going to deal with the first unit. Okay. First unit is introduction to research. Okay. What is research? Research means finding new knowledge through the systemic way. Okay, finding new things, that means finding new things in a systematic way. There will be some systems, in this way only we should go, that only we are saying is a systematic way. The research has certain formulas, has certain rules and regulations, through that only we have to go. Okay, that only finding the new things in a systematic way, that is known as research. Okay, research, the word research we can divide it into two. Research, re means again, search means find. Okay, re again and search is finding new things again and again, that is research. Okay, next in the syllabus there is the next topic is need for research in nursing. Why the research is needed in nursing? You may also think why the research subject is there in nursing. Okay, one thing I will say, without research nothing is there. Okay, I will say the point by point, I will explain some points why the research is needed in nursing. First point, why the research is needed in nursing is for developing the valid ways for procedure. What's by that? I will give you the example. Okay, for developing the procedure, for example, I will say for doing catheterization. Before catheterization, we have to inform the patient that I am going to do catheterization. We have to explain the procedure to the patient, and we have to get the consent sign from the patient. If the patient is unconscious, means we have to get the consent sign from the guardian, and after getting the consent sign we have to clean the area, and all these are the procedures. Okay, how they formulate this procedure, for that nursing is needed. In earlier days there may be not these procedures. After maybe without cleaning they would have done the catheterization, so there may be a chance for infection, and some patients got infected, so they done the research maybe. Okay, and they found that without cleaning, if you do the procedure, means there is a chance of infection, so we can prevent the infection. How they found this? By research. So for developing the valid ways for procedure, the research is needed in nursing. Second point is decision making for teachers. In teaching field, for making decision, the research is needed. The teachers takes many decisions by seeing the research. For example, I will say one thing. Some teachers will keep exams daily for the students. Why? What is the reason? Some research has said if the students wrote exams daily, they will study daily and it will be good for the students. So they are keeping exams daily. It may be difficult for you, but it is some research has said if students learn by writing something, they will not forget it. This is one thing. So only the teachers are saying to write the exams. Okay. Third point is documentation. In hospital fields, they are following many documents. Why? It is based on the research. For example, I will say in medication, after giving the medication and all, we have to, as a nurse, we have to sign it in a chart. Why? In previous days there was not signing procedures and all. At that time there were many medical errors. The nurses will not give medicines to the patients correctly. For preventing that, they followed the method of documentation. Whenever the staff nurse give the medication, they have to sign it with time. Now they avoid that medical error. For this purpose, research is needed in nursing. Fourth one is social demand. Okay, in community, we can say in a community, what is needed? For finding that, we have to do research. For example, in an area, there are many people get affected with malaria. Means what we have to do in that area. For finding that, we have to do the research. Next one, fifth point is advance in field. That is updation. As a nurse, we have to get updated. What is new things in the healthcare settings? We have to know that. Then only we can survive in the modern world. For example, previously and all, we have to do CPR by ourselves with our hand. Nowadays there is a machine. The machine will give CPR. This and all, we should know it. There are 5 points in need for research in nursing. That is first one, for developing valid ways of procedure. Second is decision making. Third one is documentation. Fourth one is society demands. Fifth one is advance in field. Okay. Next topic in syllabus is nursing research definition. Nursing research is research that provides evidence used to support the nursing practice. Once more I will say, nursing research is a research that provides evidence used to support nursing practice. Research is the evidence used in the nursing practice. What are the things which we are doing in the hospital is based on the research. If we have to do catheterization for a patient, means we have to follow the procedures. Without the procedure we can't do. If we have to do the IV cannulation, means we have to follow the procedure. Before IV cannulation, we have to clean the area, we have to inform the patient, we have to inform the procedure, and we have to inform for what purpose we are doing IV cannulation. These are the procedures, we have to do that. Okay. Next one is definition of research. Research is defined as the creation of new knowledge or the use of existing knowledge in new and creative way. After research, we are getting some new knowledges. That new knowledge, we have to use it in a creative way. For that purpose only we are doing the research. Okay. In syllabus, the next topic is scientific method or the steps of scientific method. Definition for scientific method is, it is a series of steps to collect information or solve problems. If there is any problems in the community, means collecting the informations and with the information solving the problems is known as scientific method. For exam purpose, I am saying in research you can write all the points with examples. That will be good for you for scoring marks. For that purpose only I am giving you example for each points. Okay. So in research, whatever you write with examples. Okay, leave that. There are some steps for that. First one is observation. Okay, what is observation? Seeing. Okay, in China what happened? Many people got death suddenly. They saw that. That is observation. Seeing that, it is observation. Many people got fever. They are seeing it. Many people got cough. They are seeing. Many people got ill suddenly. They are seeing. That is observation. That is the first step in scientific method. Second step, questioning. They saw the many people got fever or death or cough. They saw it and they asked question, why it happened? That is questioning. Why the people got affected with fever? Why the people got death? That is questioning. That is the second step. Third step in scientific method is research. They are searching. Previously, is there any related diseases or any related illness. They are searching for the old articles or old research. Is there anything related? And they are relating with this disease. Is there anything relating to this disease, this fever or this sudden death? Is there anything related? That is research. They are looking for the previous one. Next, fourth step, hypothesis, formulating hypothesis. It is an assumption statement. Assumption means thinking that maybe it is right. Maybe it is right or wrong. Hypothesis means it is an assumption statement. Maybe wrong or right. For corona, they have found the previous researchers and they got a doubt that maybe a chance of virus attack. Next they found the hypothesis. There is a significant relation with virus or some other thing. Fifth step is experiment, doing something to find is the hypothesis is right or wrong. Experiment. For example, in corona, what they have done? They done research in the patient, those who got illness or those who got dead. They done the experiment with them. By that only they got the conclusion. The peoples got affected with coronavirus. Next one is sixth step, test hypothesis. First they formulated the hypothesis. Now they are testing here. Is the hypothesis right or wrong? The people got fever or got dead due to the coronavirus or not? That is the testing the hypothesis. Next one is draw conclusion. Next they found that yes, the hypothesis is correct, that the peoples died due to the coronavirus or COVID-19. They come to the conclusion after the research. Next step is communicating. What they found, they shared the result to the others, all the countries, that this corona is communicating to all the countries, so please be aware. This is scientific method. Steps for scientific method. First one is observation, second one is asking question, third one is research, next one is hypothesis, next one experiment, next test hypothesis, next draw conclusion, and last one is communicating. There are 7 steps in scientific method. Next topic is characteristics of good research. There are many research, but what are the characteristics of good research? This is the next topic in your syllabus. Okay. First point, research should be directed towards the solution of a problem. Whatever the research which we are doing, there should be a solution for the problem. Without any use, we should not do the research. For example, the questions which we are asking should be a reasonable one. It should be a useful one. The research which we are doing should be used in a clinical setting or hospital setting. Next, second point, research demands accurate observation. While doing research, while collecting the data in research and all, we should collect accurate data. If we are collecting data from the patient or community peoples, we should be honest in collecting the data and all. We should not manipulate. Third point is research should be carefully designed. Okay. While doing the research, while selecting the design, we should be careful in selecting the design. There are many subdivisions in design. We should be very careful in selecting the design. We should not select a wrong one. for our study, which is the appropriate design, we should select that. Fourth point is research sometimes requires courage. Fourth one is research sometimes requires courage. That means if we do some researches in community, what about the health status of the people in the particular community, while doing the research there will be some problems from the politicians. If we say they are unhealthy, means in that particular area the leaders will not allow us to give the proper reports. If we give the proper reports, it will be a problem for them, so they will say you should manipulate, you should change the result. In that time we should be courage, and whatever the result we got in research, we should publish that. Next point is research involving the quest for answers to the unsolved problems. In the particular time, whatever the unsolved problems are there, we should solve through the research. For that purpose only we are doing the research. Next, research should be in a simple language. Whatever the research we are doing, we should publish it in a simple language, so that the people, those who are reading or looking after that, can understand that. So we should publish it in a simple language. These are the characteristics of research. Next, I am going to deal with the main topic, that is research process. This is a 10-mark question for you. This is a very important question, so please careful. Okay, there are 5 phases in the research process. Okay, in many books they have given many headings and all. This is the easiest method, I think so I followed this one. Okay, you can follow any books you want. Okay, I followed this because I think that this is a easy method for you, so I followed this. Okay, there are 5 phases in research process. They are assessment phase, diagnosis phase, planning phase, implementing phase, and evaluation phase. As like which while you are writing the nursing process and all, you will write assessment, planning and all, same thing. Here also same thing, only the first one is assessment phase, second one is diagnosis phase, third one is planning phase, fourth one is implementation phase, and fifth one is evaluation phase. These are the 5 phases in research process. Under that each phases there are some subheadings are there. I will explain that. First one is assessment phase. Under that first one is identifying a researchable problem in nursing. Under assessment phase there are 3 headings. That first one is identifying a researchable problem in nursing. What is my researchable problem? For example, I said previously, one doctor used only normal saline for cleaning the wound, second doctor used only betadine solution for cleaning the wound, and third doctor used both. I got a doubt, which is best? That is a question. The first heading is identifying a researchable problem. This is the problem. Which is best? This is the question. For getting a good research, or for doing a good research, the question should be a good one. Next, second point is formulating the research proposal. Formulating means we are formulating for how many patients or how many samples we are going to take for the research, in which area, in which settings we are doing the research, how much money we are going to spend for the research. This is known as the formulating the research proposal. Okay. Next, third point is defining the concepts and variables. Defining the concept and variables. In this, we will do the statement of problem. Okay, that is the research proposal. In research proposal itself, we will find the statement of problem. In the statement of problem, what are the words we are using? For that, each words we have to give the definition. For example, I said no, normal saline, betadine solution and all. For what is we have to write the definition for normal saline. We have to write the definition for betadine solution. This is only saying as defining the concept and variables. The research proposal, we will give the statement of problem. In the statement of problem, what are the words we are using? For each words we have to give a definition. This is the third point. In this, the first assessment phase is complete. Next, we are starting the second phase, that is diagnosis phase. Under diagnosis phase, we are having 4 headings. The first one is stating objectives or hypotheses. Stating objectives or hypothesis means we have to formulate the hypothesis here. As I said earlier, hypothesis means assumption statement. That is, through research we are going to find the hypothesis correct or wrong. For example, hypothesis means we are saying that there is a significant relation between whatever it is, the variables we can mention there. Next, we are saying there will be a relation between post-test and pre-test. This is hypothesis. This hypothesis we are testing and finding that this hypothesis is wrong or correct. We have to formulate the hypothesis in this place. Next point is examining the ethical implications. That is second point in diagnosis phase. Examining the ethical implications. Examining the ethical implication means before doing the research, whom are the persons we are adding in the research, we have to inform them for what purpose I am adding you to the research, what are the procedures I am going to do in this, and whatever is there any complications for you. In diagnosis phase, the second point is examining the ethical implications. Ethical implication in the sense, before doing the research or before involving the person in the research, we have to inform them that I am going to adding into the research, and what's the purpose that I am going to do research. This and all should be explained to the person. After that only we should involve the person in the research. And also, because of our research, the patient should not get affected. That in these conditions and all, we should be very careful. Before taking the patient into the research, we should get the consent from the patient. Okay. Next one is third point in the diagnosis phase. That is review of literature. Review of literature means, as a UG students, you can't do the research directly. For that, there should be a supportive studies. If you are going to do research about the coronavirus or COVID-19 or whatever it is, means you should need some supportive studies for that. With that supportive studies only you can do the research. If there is no supportive study, means you can't do the research. For that purpose, review of literature is needed. Before doing the research, refer some articles or research regarding our studies. Next, fourth point in diagnosis phase is identifying theory, assumption and limitations. In this, we are limiting our study and we are giving a theoretical framework to the study. How we are going to do the research, in which method and which design we are going to do. This and all we are formulating in this place. In here, the diagnosis phase we are finishing. Next one is planning phase. In planning phase, there are 4 headings. First one is describing the research design. Which design going to use for this study. If we are doing any experiment in the patient, means it comes under the experimental design. If we are not doing any experiment, means that comes under the non-experimental design. Here we are going to select the design according to our study. If you are only observing and we are not doing any experiment in the patient, means that is known as non-experimental study. If we are doing any experiment in the patient, means we are saying it as a experimental study. Here we are finding or we are selecting a design. Next, second point is describing the research methods. We selected the design. Next, we are going to describe the research method, how we are going to select the sample. According to our wish, we couldn't select the samples for the research. For that, there are many rules and regulations. In which method? Lottery method, or random sampling method, or whatever it is. That and all I will explain you in next units. Okay, just introduction I am giving for you. Okay, next, how we are going to collect the data, describing the research methods. In this, we are going to select which sampling method we are going to use, how we are going to collect the samples, how we are going to collect the data from the samples. This and all we are going to select in this phase. Next point is obtaining informed consent from subjects for pilot study. Next, we have to do the pilot study. Pilot study means it is a sample study or small study. If you are going to do the main study with 30 samples, means here we have to do with 3 samples, 10:1 ratio. That is, pilot study means it is a smaller study which we are doing before the main study for knowing is there any problems in our study. Okay, main study ചെയ്യുന്നതിന് മുൻപ് നമ്മൾ ഒരു ചെറിയ സ്റ്റഡി ചെയ്ത് നോക്കുവാണ്, എന്തെങ്കിലും പ്രശ്നമുണ്ടോ നമ്മുടെ സ്റ്റഡിയിൽ, എന്തെങ്കിലും തെറ്റുണ്ടോ, നമ്മളെ കൊണ്ട് മെയിൻ സ്റ്റഡി ചെയ്യാൻ പറ്റുമോ, അത് നോക്കാൻ വേണ്ടി ചെയ്യുന്നതാണ് പൈലറ്റ് സ്റ്റഡി. മെയിൻ സ്റ്റഡി 30 പേഷ്യൻ്റ് വെച്ച് ചെയ്യുവാണെങ്കിൽ ഇത് നമ്മൾ 3, ദാറ്റ് മീൻസ് 3 പേഷ്യൻസിനെ വെച്ച് ചെയ്യണം, 10:1 ratio. For doing the pilot study, we have to get the consent from the samples, other patient, those who are going to involved in this research. Okay. Next one is conducting the pilot study. We are doing the pilot study, that is in the 10:1 ratio. We are doing the pilot study and we are finding is there any problem in the study, is the research design is correct, is the sampling method is correct, will we get the sample for main study, how much expenditure is needed for our study. For looking at all this, we are doing the pilot study. Fourth one is implementation phase. In that there is only one subheading, that is collection of data. In here we are doing the main study, we are collecting the data from the samples and we are doing the main study. Here we have to go according to the research design and according to the sample procedure what we have mentioned earlier. There should be no bias or anything. Our research should be go in an accurate way. Next, fifth phase is evaluation phase. Here we have 2 subheadings. First one is analyzing and interpreting the data. We have collected the data in the evaluation phase. With that data we have to analyze and find that the hypothesis which we have formulated is correct or wrong. Hypothesis is true or false. Here we have to make the tabular columns and all, whatever the data we have collected, we have to make it as a tabular column. We have to score, we have to give marks for that, and we have to do the analysis. Last point is communicate the findings. You have done the research and you got the result. whatever the research you have done, you have to follow it in the hospital wherever you work. That is communicating the findings. You have to inform to others or superiors. You have to show the research to them. You have to publish the articles. You have to inform them orally or written on. And you have to follow that in the hospital settings. You can publish books or whatever it is. That is communicating. That's all. Okay, research process is over. One unit is over. Okay, research process is an important question, so please try to study that. That's all. First unit is over. Wait for the second video for second unit. Bye bye.